Good afternoon, my name is Haley Sumner. I'm a nurse practitioner student with Auburn University. So what brings you in today to the clinic?
I'm bringing my granddaughter. She is complaining that it burns when she pees.
Okay.
I've had lots of UTIs before.
Okay. Is she allergic to any medications?
I'm allergic to sulfur, but I don't think she's allergic to any medication.
Okay. Well, I'm looking at her urinalysis and she does have a little UTI, so I'm going to put her on some Bactrim. Some of the names of the most commonly prescribed sulfonamides are sulfamethoxazole, sulfasoxazole, sulfadiazine, silver sulfadiazine, sulfastamide, mefenide, and sulfamethoxazole in a combination with trimethoprim, and that's also called Bactrim or Septra. Sulfonamides work by inhibiting the synthesis of tetrahydrofolate, which is a derivative of folate. And in the absence of tetrahydrofolate, bacteria cannot synthesize DNA, RNA, and proteins, and thus it halts the further spread and growth of bacteria. The primary therapeutic effects of sulfonamides are the treatment for UTIs, and they could also be used for infections that are caused by certain bacteria such as Nocardia astroides, Listeria, P. urevitsi, and C. trichomonas. Sulfonamides are synthetic bacteriostatic antibiotics with a wide spectrum against most gram-positive and many gram-negative organisms. They inhibit the multiplication of bacteria by acting as competitive inhibitors in the folic acid metabolism cycle. Sulfonamides are well absorbed when taken orally, and the peak absorption time is between 1 and 4 hours. When it's used topically, it may be absorbed systemically. Sulfonamides are also well distributed to all tissues. Concentrations in the pleural, peritoneal, and other bodily fluids can be as high as 80% of the blood concentration, and they readily cross the placenta and may cause fetal toxicity. Sulfonamides are metabolized by the liver and they are excreted via urine and feces. Use with caution when prescribing sulfonamides to elderly patients, and this is due to the increased risk of bone marrow suppression, as well as the increased risk of developing C. diff and superinfections if it's prescribed to patients over a long period of time. Some contraindications for sulfonamides include renal impairment or creatinine clearance of less than 15, hepatic impairment, folate deficiency anemia, obviously a hypersensitivity to sulfonamides, infants less than 2 months of age, breastfeeding mothers, and mothers who are 32 weeks or greater pregnant. Some of the adverse drug reactions, more mild and common reactions include fever, rash, and photosensitivity. Some of the more severe reactions are going to be things like Stevens-Johnson syndrome, and this is rare. And then some of the drug interactions are going to be warfarin, phenytoin, glipizide, and glyburide, because sulfonamides increase the effects of these medications. The primary clinical indication for sulfonamides is the treatment of a UTI, and less commonly, sulfa drugs may be prescribed in conjunction with pyrimethamine to treat malaria and toxoplasmosis. Topical sulfonamides may be used for eye infections as well as suppressing the bacterial colonization in burn patients, and sulfasalazine can be used to treat ulcerative colitis. 90% of UTIs is caused by the bacteria E. coli. So the rationale behind using sulfonamides in treatment for UTIs is that E. coli is usually sensitive to sulfa drugs. And sulfamethoxazole is the first-line drug choice because of its good solubility in the urine and its effective concentration in the GU tract. As a provider, if you have a patient who is on sulfonamides, you want to be monitoring a weekly CBC as well as hepatic and renal functions. And you also want to look at coagulation studies, especially on patients who are on blood thinners. And you want to be watching for things like yellowing of the skin or rash. When educating your patients on the administration of sulfonamides, you need to tell them to drink a glass of water with each dose, as well as increase their water intake throughout the day to 8 to 10 glasses. Also, they need to be aware that even if their symptoms subside or improve, they should still finish the full prescription course of the medication. Also, they need to be wearing protective clothing and sunscreen when they're out in the sun to protect against photosensitivity, and they need to notify the prescriber if there's any kind of rash. And here are just a few takeaways from this presentation today to remember as nurse practitioners when you're prescribing sulfonamides to your patients. First of all, just remember that sulfonamides, and specifically sulfamethoxazole, is the first-line choice drug for treating UTIs in patients. Also, you need to remember to monitor your CBCs as well as renal and hepatic functions, and to monitor the coags, especially if your patient is on warfarin or any blood thinners, or phenytoin also. And then you want to avoid use in children less than 2 months of age, avoid use in breastfeeding women, and women who are 32 weeks or greater gestation.